according to Western medicine, and you pretty much should have an understanding of anatomy, but we'll be reviewing anatomy and going over some of the pertinent points that relate to clinical examination. And then we're going to assess musculoskeletal dysfunction. And then you need to know how to report it as far as Western medicine for either insurance companies or other providers. And then to recognize when someone's going to need an x-ray, or if there's certain red flags where somebody needs to send them off for other evaluation. And then the textbook, I didn't bring mine with me, but I know somebody, he's got a paperback version right there, but there's a hard copy is the one I think they have in the bookstore. And then also there's the notes here that is also in the bookstore. I don't know if there's another versions that I made before that if you have one of the other versions of the notes, you'd probably be okay. There's a couple changes, but you can probably get by. And the other things that you're going to need is a reflex hammer. I didn't bring mine with me today, but everybody pretty much knows what that is, right? And then you have two options of how you can go. These are goniometers. Okay, this is a larger version. A lot of people will have the little smaller version. It just measures joint motion. Okay. I think these are about, this one would be a little bit more because it's bigger. I think the other ones are about 20 bucks. Or you can go with the other option here, which is dual inclinometers. Okay, an inclinometer, basically with this you have to usually hold one part parallel to some fixed object, and there's inaccuracies because you're not holding it perfectly parallel to the ground or perpendicular. Whereas this takes it out of it because it's basically using gravity as your reference point. And then you can buy the fancier ones. That, if you get one that's quote medical inclinometers, you're going to spend $100 or so. Or you can. These are about 10 bucks each. So you're looking at 20 bucks. Get a piece of dowel and strap it on like that. Sometimes you're only going to use one, and the reason why it has this dowel on it is, let's say if you're going to measure shoulder range of motion, you just go like this. You don't need two. The times when you're going to use two is if you're going to measure spine motion, basically. So you would hold this here and then move forward like this. Basically what that does is it subtracts out the motion that occurs here. Because if I'm doing this, some of my upper back is moving. And so if you just measured from here, you wouldn't get the accurate reading. What this does is it subtracts out the motion that occurs from that point below. And then the same thing you're going to do with the lumbar spine. When you went forward like this, some of that motion occurs at the hip, and so you're subtracting that out. So either way that you want to go, you need to know how to do one of them. I mean, you're not, on the test, you're just going to have to show one method. You don't have to know both. And then it gets a little confusing on here, because if you start from here, you don't have a zero, and then you have to do math. If you just get one of these, it's like another couple bucks or something, then you can make zero wherever you want. Okay? As if you get the fancier ones, you can make the 0 point wherever you want it to be. But this way, for like 22, 23 bucks, you're pretty well set. So either way, either goniometer or inclinometer. All right, so then basically what you're going to be doing in this class is there's going to be quizzes every week. You get to drop the lowest one. So you want to keep up on the material and go over the quizzes. Usually, that's where these things will help, as far as make sure that you know all the stuff on here. It doesn't mean that there's not going to be some stuff that's not on here, but for the most part, if you know all the stuff that's on here, you'll be pretty well set. Then there's going to be 2 case studies. I didn't work out exactly when the dates are on them, but basically it's due the week before the review. So we need to write that in on the outline. Based on week 6 where it says wrist and hand exam, That's when the first case study is due. And then week 12, where it says lower leg, ankle, foot, that's when the second case. And,
12, you said?
right. Yeah, it's the week before we have a review. The review is going to be for the midterm and for the final, so the week before the review is when we need to turn it in. And the preferred method of turning it in is going to be email. Okay? And then that actually reminds me, the first assignment you have, and I think it's already on the secure side, but basically all you got to do is send me an email. And my email's right here on every page of this handout. All right? Send me an email, basically so that I'll have your email. And then things that you can include in that is, maybe how you decided you want to become an acupuncturist, what type of way you want to practice. If you go on the secure side, there's more of a description of it. Okay? Basically that's so that I'll have your email address, and then whenever, if I post something onto the secure site, or if there's, most of this class already is on YouTube. And the first couple weeks aren't, but as I film it, then we'll have the rest on there. So if you want to review the classes or something, it's on YouTube. And we'll talk about how to find that a little bit later.
You want us to put anything in the subject line of the email, so you know it's from the class?
Yeah, you can put ONE2, and then also just make sure you put what like it's Tuesday morning class, because I have another one on Thursday evening, I think it is. So just say I'm in the Tuesday morning class, and whatever we want to include. The main thing is just that, so that I have your email, so that if I post stuff up or if there's announcements that need to be made, that you'll get in the loop. And then the midterm and the final are practical exams. Basically what you're going to do is you're going to draw a card, and the first half of the class is from the neck to the thoracic spine, including the upper extremity. So there'll be some case, you'll draw a card that says somebody has shoulder pain, and blah, blah, blah. Then you need to do a history, examination, diagnosis, special tests, all that stuff. And then the case study is going to be, the first case study is going to be that part of the body, so the upper extremity to the thoracic spine. The cervical and thoracic spine, and shoulder, elbow, hand, and wrist. Then the second case study will be lumbar. And basically what you're going to be doing is you're going to go to some type of practitioner, whether it be acupuncture, orthopedist, neurologist, chiropractor, physical therapy. I probably don't think a massage therapist would be doing enough of an exam for you for it to apply. So then you're going to observe, and then you're going to write down your findings, and there's a specified format, and we'll pass the handout later. Basically, there's certain things you need to include. If you include those items, you get the points for it. If you don't include those items, you don't get the points. It's pretty straightforward. And then the midterm and final are going to be similar to what you have to do for the case study. You have to get certain elements to take in history, certain things for observation, palpation, range of motion, special tests, and neurologic tests. All right? And then you have to have, your attendance has to be at least 75%. So basically for a 14-week class, the way that it works out is if you miss more than 3 classes, you can't pass the class. All right, do you have any questions? Did you start the camera? Okay.
Who's going to miss a quiz? You just hang it up next week?
You can make up